to deliver. So that's the issue in itself. So I had to get a cerclage with Callie at 13 weeks so she wouldn't fall out. So that's initially what happens. The baby will fall out. I don't know when I'm going into labor or anything like that. But on top of that, I also had preeclampsia. So my blood pressure was really, really high. I immediately, at about 7, 8 weeks, they put me on partial bed rest because of the incompetent cervix and my history with high blood pressure from previous pregnancies. And with Miss Callie, my blood pressure got high. I was on blood pressure medications, going to the doctor back and forth. And then she stopped growing. The umbilical cord, because of my high blood pressure, damaged the umbilical cord. So she was not able to get any nutrients. So it started restricting her growth. Her brain was growing fine, her heart, but her body was not. So I was told I had to go to the hospital and make a decision to, get rid of the baby because it just was not going to be safe for either one of us. I did not make that decision because she's still here, but the main reason was because my blood pressure was extremely, extremely high. It got up to like 280 over 190. So it was just horrible. So with Miss Callie, I was in the hospital. Her heart rate was dropping. So we had to do an emergency C-section. So that's what brought her here at 26 weeks. 26 weeks. And then the journey began.
Right. So it's crazy because with the NICU, it's like there's normally sometimes there's like a traumatic event or something happens that caused you to go into preterm labor, right? But that is just like one season, and then you start day one with the NICU, and then discharge day is another day one, right? You keep kind of like starting over and over and over. And so from that, Callie was in the NICU 339 days.
339 days. Yes.
He is, girl, such a fighter. And so, okay, as we get closer and closer to discharge, when did did you know she was going to need a trach? Because she was on oxygen the whole time. So when did you find out that she was going to need a trach?
So that came about this year in January. I did not know that Callie would need a trach. I thought Callie, because she was intubated. So what ended up happening, we was at one hospital. Callie ended up catching pneumonia and just was not doing well. She actually was extubated for a couple of weeks, but they had to intubate her again because she caught pneumonia and had to be transferred to children. So I had no idea from the day she was born up until January of this year that Callie would need a trach. As far as I know, that she would be extubated again, and we would go home and we wouldn't need anything. So that was my mindset. I did not know.
Right.
Obviously the doctors had talked about it, but I didn't know anything about it until they brought it to me in January. So I didn't know. Had no clue. Wow. And I was scared.
Yeah, and that goes. That's what I want to know. Like, so when they told you, like, okay, so your daughter is going to need this procedure to be done, like, what was your initial feeling, right? Because we have some moms that might be battling with the decision of like, or not moms, but moms, birthing people, fathers, should we proceed with this procedure? Was it something where you got an option, or they were just like, we have to do this?
No, I had an option. Okay. So the option was to keep her in the hospital for about 3-4 years, because that would be how long it would take for her to, essentially for her lungs to develop and for her to get for lung growth. So initially I was not for the trach. I was not, because I didn't know anything about it. No one had told me anything about it. It was just, we had a family meeting and that was my option. Your daughter's going to be here for 3 or 4 years, or we do the trach. I'm like, I don't even know what that is. So I'm like, you're telling me, I'm like, what is the trach? Like, I'm not understanding, because I thought my daughter was doing fairly okay and for you to tell me 3 or 4 years in the hospital, that was a bit much. So of course my other option was the trach. But it didn't come easy. Because they told me in the beginning of January, and obviously Callie didn't have the procedure until mid-February, because it was just some things that I had to do for research purposes, and talk to you, and just talk to other people or do research just to figure out what was the best option for my baby. I know I didn't want her to be in there for 4 years. I did know that.
Right.
So I just it took a lot of me being tired, because at that point I had been in a hospital for months.
Yeah.
So to hear the doctor say 4 years, it was like,
right.
That wait a minute now, like, 6 months, I don't have any hair, but I'm trying to pull a little bit of, so
it was fabulous, sis.
Yeah, it was, so that was hard to hear, because when you don't know and they just say, oh, she may need a trach, but no one is really explaining to me what a trach is.
Right.
So it was scared. I was scared, and it took a while. But eventually, it was after I found out what it was and they explained it to me, it was a more easier decision for me, not an easy decision for Dad.
Yes.
And so both parents, of course, have to, agree, especially when you're married. You have to agree on the procedure. So that took him a while, because he just did not want a hole in his daughter's throat. Because when you have a trach, you have all these other issues that comes with having a trach. So it was not an easy decision. I was scared. And I didn't want it done. I'm going to be honest. I did not want it done. I did not want my daughter to have a hole in her throat. I just want it done.
Now I'm going to pause. There's a little bit of a delay, sis, with your mouth and your words, but y'all stay with us because the information is so good. You okay?
Okay.
So, okay. And so that's another question. So when it comes to your spouse and your family, how did they react to it? Like how you said your husband, it took him a little longer to come around. So Lakeithia is at home with the baby, y'all. So we just
yes.
But so it took your husband longer to agree on the procedure?
Yes.
And what did your family like? Did they have questions?
Well, that's another story. My family did not know I was pregnant.
Oh, that's right.
So no one knew that. I mean, other than you, the doctors, no family knew that I was pregnant or had Miss Callie. So the decision was solely up to myself and my husband. But I say more so me, because I was the one that was going through it, because my husband wasn't allowed at the hospital during COVID. So essentially the decision was really up to me. But like I said, he did not want it to happen at all. And I think it's more so for him, and just speaking for him and just having a conversation with him, it was more so for looks and for people to stare, questioning, people not being nice, because when you have medically fragile children, some people are just not nice. And so for us to go to from having one child that's what society consider as normal, and to go to a medically fragile baby, what would that look like? So I think for the most part for him, it was more so like, what are people going to say? Are people going to be mean? Are people going to be nasty? Are people going to think we did something wrong? It was just a bunch of questions that essentially, as mothers, as I say for myself, I already felt like I had did something wrong anyway.
Right.
So for society, for society to ask me or look at me funny, on the outside, it was just those type of questions. So it was hard. It was so hard for him. It's still hard for him.
Yeah.
It's extremely hard on family now that family does know, but initially no one knew I was pregnant. No one knew I was pregnant. No one knew I had the baby. All of these decisions were on me, which was really, really tough. And no one found out about her until she came home.
And so, first of all, I just want to commend you, because that's a lot to go through without your family support, because like I'm so close to my family. I can't imagine like dealing with all of that by yourself, pretty much by yourself. You're in the hospital by yourself. You have to make these decisions in a room that might feel so much bigger than like your mental capacity at the moment with everything going on. And so the fact that you made the decision to do that is such a blessing. And thank you for your vulnerability, because, we're not going to, like, you don't hear this often, right? People aren't going to say like, well, I don't want to do it because I don't know. Are people going to be mean? People are mean. People's own implicit biases when they look at, other people that aren't considered normal or, have special needs. And so, we love you. We appreciate you. And thank you for being that vulnerable and for letting us into that space, because it's a real thing. Marlon was discharged with oxygen. And I remember thinking, I never voiced it out loud, but I was like, what are people going to say when they see me with a stroller and this big old oxygen tank, or like, how am I going to you can't just go to the grocery store when you have a baby who has a trach, who has oxygen and everything else that comes with it, so it's a lot that goes in your head. And but the decision you made, 4 years in the hospital or go home with medical, equipment, let's just go on home and we'll figure it all out. Right.
And you know what? That was the battle. My battle with my husband was, you're not here with the baby. You can't be here with the baby. So, I don't want to do this for 4 years. I just didn't.
Yeah.
And then too, I didn't want to let everyone know either, because she was in such a fragile state.
Oh my goodness. That's so
good.
The girl. And so now with the trach, what comes with the trach? Because it's not just the trach, right? Callie has multiple medical I don't want to say, equipment that goes along with the trach. Can you run that down for us so people can get an idea of what your day looks like?
Of course. But so yes, go back to your initial question. So yes, I would recommend getting a trach, depending on whatever your situation is. To all mothers, just if you really want your baby home, depending on what their situation is. My daughter, hers is primarily her lungs, so that was an easy decision for me. So the trach was obviously the best option for me, and to see her face. Initially, when Callie first got the surgery on February the 12th, of course, they cut this hole, and your baby has to be paralyzed for like a week. So they can't move. They can hear you, they can feel you, but they can't move. So that was really hard for me.
Yes.
For my baby to hear me, but not being able to react to me. I'm so sorry.
No, you're good. This is you know how our chats go.
So,
you're good, sis.
So that was hard for me, and for me to actually see it.
Yeah.
Because I didn't have a clue. You see the pictures on the internet, and you see, but to actually see it is very, very different. It's very, very hard. And they have to make sure that it's a good fit for your baby. So even though, your baby has this trait, it may be too short, it may be too long, your baby may get granulations, your baby may get all types of things that closes up his or her throat. So that was a fear of mine, but they didn't tell me, honestly, the amount of equipment that I would need for my daughter. So we have an oxygen concentrator because she definitely needs oxygen. We have a suctioning machine. We have the ventilator. We have the oximeter where it measures her oxygen and things like that. So that's just something that's in the home. We have to have travel oxygen. We have to have a portable oxygen machine. We have a portable, my mind is just like, oh, because I'm crying. But we have to have a portable suction machine, and we have to take all of this stuff with us. And they also give you this stroller depending on whatever your baby situation is, a big old stroller. And I'm gonna be honest with you, it's hard.
Yeah.
It's not as easy as it look. I know I make it look easy. A lot of they say, oh, you make it look easy, but it's so hard because you have all these alarms going off, and the trach, you have to have extra trach because the baby may pull it out. It may come out, it may fall out. And what do you do in a situation where you're by yourself? Because it happened to me, and they telling you you have to have two people to change the trach. So it's a lot. It's a lot to get everything ready, to get the machine ready in the vehicle, get the oxygen ready, making sure you have enough space, making sure you have enough oxygen. The battery life on the ventilator is, it doesn't last for like an hour or two. So if you're out in public and the battery life goes, you're hearing a beeping sound, and of course people are looking like what's going on. So it's a lot of equipment. You can't really travel unless you have a plug in your vehicle to make sure that the baby ventilator is always plugged up. Now my baby has an LTV, which is a larger model, which she needs. Some patients go home on the Astro, which is a lot smaller and can go longer, but my baby's machine can't do that. It only lasts about an hour and a half, 2 hours. So it always has to be plugged in. And we also have a humidifier that we have to have with her to make sure that her lungs and everything in the inside's not getting cold, that the mucus and stuff is able to come up, because if she gets too cold, it'll clog her up, and that causes a mucus plug, and that essentially could kill her immediately. So you always have to be on the watch when those machines go off. If her oxygen level drops below a certain amount, it's a lot. You don't get any sleep. So that's if you come home, I say you definitely need you need help. Don't be afraid to ask for help, but you need a lot of stuff.
Yeah.
A lot of stuff.
And you've been doing it, and Callie is still over there just doing some amazing things. Is she crying right now?
Who, the baby? No, she's asleep.
She's asleep. Okay. No, she's doing some amazing things. So, okay, look, I have all these questions, but let me go down. Okay, so we already talked about travel. Now, what are
we haven't traveled. We've only traveled to the hospital. I asked them today, how far can she travel? But of course, with traveling, whatever destination we go to, we have to make sure we have enough meds. On top of that, she has a lot of meds. You have to have meds, oxygen. You have to know where the nearest hospital is. You have to know the nearest medical equipment place that's there, to make sure if you run out of anything that they are able to supply your needs for you. So we really haven't traveled anywhere yet. We can't travel on the plane because everything has to be approved. Her ventilator has to be approved by the FAA, her oxygen, her humidifier, her oximeter, everything has to be approved prior to us even traveling. So we haven't had the opportunity to travel yet because she's just, I guess they just don't want it to be a liability at this point for them.
Yeah.
If something was to her and they're not able to plug her up on the plane because she has to have a plug. So we haven't been able to travel on a plane, on a train, but in the car, because we do have a plug, we can travel, but you haven't have enough oxygen.
Yes, and those oxygen
And they
tanks
don't
run
give
out.
yeah, the oxygen, they only give me, for my baby, 15 tanks a month. So to try to travel to say to Vegas on 15 tanks, we couldn't do it.
Yeah.
We just, it's physically impossible, unless you take the concentrator, which is really, really huge. So it's, for us right now, it's not feasible for us to travel because we don't have enough oxygen.
And it's safer, right? There's still so much stuff out there. I'm just like,
but I want to travel, but it's hard. I'll say it's hard.
It's hard. Now, okay, so what are some things that Callie can do with her trach? And what are some things like she can't do? Because now she's getting older. I'm sure she is moving around. She's trying to take this thing off. What can she do? Is it safe for her to crawl? Like, and this will also roll into like, what are some true things about trachs and some false things? Because I'm sure there's some narratives out there that like people might think babies can't do certain things and they can, or they might think that they can do certain things and they can't. Yeah.
So for the most part for Callie, because she was in the hospital for almost a year, developmentally, she's behind. Because she was laying on her back. So she's behind. So what somebody else's baby may be able to do, Callie's not able to do because she just wasn't afforded the opportunity. But right now, Miss Callie is sitting up. Yeah. She's standing. She's able to roll. However, it's hard for her to roll from her back to her belly because the trach and all the tubing, is heavy. So when the baby gets ready to turn, for the most part, I say with my baby, she's scared, because when you turn, if you don't have the ties tight enough, the trach can pop out. The whole everything pop out. So she pretty much can do everything. And we're in physical therapy and occupational therapy, so she can learn how to do those things. But as far as I'm told, trach babies they can walk, they can crawl, they can roll, they can do all of these things. The biggest caveat behind that is the baby being strong enough to be able to crawl with Callie. Her machine is 15 pounds bigger than her. So that will be our kind of like downfall, our kind of setback, because she's just not physically strong enough to be able to pull the machine, the oxygen, the humidifier, and all these different things that she needs to survive. But she is able to do some things. I've sent you a few videos, and you need videos and things like that. But she is able to do the majority of the stuff that I would say, as society say, a normal baby would be able to do. Like I said, depending on what your baby situation is, and how long they've been in the hospital, that would be a determining factor on what your baby can and can't do. And right now, Callie is developmentally, she's at like maybe 3-4 months.
Okay. And that is totally okay. Her day, her discharge day was her day one. Okay.
So that's good. And as for feeding for her, because she's never really taken anything by mouth, and so what I've been told about trach babies is their palate is, they can't taste as well, because of the hole and the things that they have going on. So she's not able to swallow as much as we would like, because if the food can get stuck in the trach, which can cause problems and cause her not to be able to breathe. So anytime that I give her any type of solid foods, I have to make sure I suction her to make sure that she's either swallowed it or I get it out, so it won't clog her up and she won't stop breathing.
Oh my goodness. You are like a nurse practitioner over there. Like, I mean, Lakeithia knows it all. When we first met, she was just telling me, you know, once you're a NICU parent, I mean, you can run down the list, okay? And so, wow. So Callie's day to day, if you guys can imagine, is extremely busy. Callie has, you know, she has a lot going on, but she also has such a strong mommy who has been holding it down for her. Callie also has nurses who come in and provide support in home to give mommy a break, which is so needed. I would recommend, I don't have a trach baby, but I would recommend that if you have the help, take it, embrace it, so that you can take a minute, because it's a lot to handle. Take a minute for your own personal space. I mean, take a minute for your own journey as you kind of go through the motions of having a baby with the trach and having a baby with special needs. Take care of your mental state is extremely important, because your baby needs you at 100%, or as close as you can get to that 100%.
And I would say for with my baby needs medications every 4 hours. So around the clock every 4 hours. So that means every 4 hours. So that means that at 3 hours and 30 minutes, you have to prep and make sure everything is ready. So even if nurse is not here, even if you don't have help, you have to get up. As far as my baby, you have to get up in the middle of the night to make sure that the baby is getting all the medications and things that the baby needs, on top of the machine going off when something is going on with the baby. So you have to make sure that you're alert at all times. So it's almost like, well, you know, when you first get your baby home and they're trying to adjust, this is years. For her, they told it'll take 4 years for her. So just imagine just me kind of having a newborn for 4 years, getting up in the middle of the night, making sure everything is essentially okay.
Yes. Now so I have another question. Do you know how long, is it the 4 years that she will be with her trach, or is this something that is just kind of like month to month, year to year? We'll see how her lungs continue to develop.
Right now, it's 4 years. I went to the doctor today. We have not changed the settings on her ventilator since she got it in February. So it depends on your pulmonology. And because Callie's lungs are still very, very medically fragile, they're just so afraid to make any little changes.
Yes.
And, you know, with her in the hospital for a year, and they don't know how she's going to do for flu season or the winter months, they are very, very apprehensive about making any changes on the ventilator. So right now, at the pace that we're going, it may be even longer. It may be 5-6 years. Because it really depends on the pulmonologist that you have and the progress that the baby is making. And although she's making great strides, as far as her weight, she's still 14 and a half pounds, and she is about to be 15 months. So it just, honestly, it really depends on the baby and your team, but you have to be very, very stern. I would say that, because.
And let me tell you about Lakeithia. Look, I'm going to our page to see if we have any questions. Let me tell you about Lakeithia has no problem speaking up for her baby. And I think that is such a blessing and something that I truly admire. Okay, let me see. Okay, no questions. I just looked on here. No questions so far. Mama and Miss and Sarah are they're just commenting, saying super mom and how amazing you are. So
thank you. Try.
No, you're doing a good job. You're not trying, bro. You are doing it day by day. Okay.
You know, I'm trying, working off 2-3 hours of sleep a day. And it's hard.
You just call me and then look, I'll see if I can send you some Starbucks and we just keep it going. Okay. I I have one more question, and then we'll close out our combo, and I'll make sure to post this online for everybody to rewatch. But if you have any advice to families whose baby is in need of a trach, what would you say? And if in addition to that, because I think you already kind of covered like that it's important, but like if you have a family who just got discharged from the NICU with the trach and is overwhelmed, is there any advice that you would give?
Oh my gosh, like that's the help. Initially, I'm gonna say, initially it's a lot because when I got home, when we got discharged, it was so many people in the home because they have to come and make sure everything is set up, everything is, so they're in the home for like 6 hours. And then they want to make sure that you're able to take care of the baby. But prior to coming home with your trach baby, you have to have a series of things that you have to pass. They have to want sure you have enough space. They have to make sure that all your electrical outlets are in perfect working order. They have to make sure that no one is smoking in the home. No one, you have no pests, no bugs, no anything. They have to make sure that you know where the nearest hospital is, the nearest fire station, because if the power was to go out, you have to make sure you take your baby to the nearest fire station, because of course the fire stations, they always have a generator and things like that. So you have to make sure that when they're asking you all of these questions, that you have to know the answers to. I didn't know, I'm gonna be honest.
I started thinking like, okay, there's the, oh my God.
Like, I didn't know because no one prepared me, no one helped me and told me that, you know, you need to know all these things. And they make sure that the respiratory therapist comes out as well. So you have to have, we had to have about a week of training with the respiratory therapist to make sure that we know the equipment, you know what to do and things like that. So prior to you coming home, you have a series of tests, you have a series of overnight visits, you have to change the trach, be able to change the trach by yourself, be able to do all the care that the nurses are doing in the hospital alone. They don't help you. So if you're, I can't say, if you have to pass basically before they even allow your baby to come home. So I would say, just what do you see on the internet? It's nothing like what you would go through day to day, because of course each baby is very, very, very different. I would say for Callie, the first night was scary. This first night alone, no help, just me and my daughter with her being home. So, and then you're scared to have people around, but to have a trach baby that she pulled her trach out. She pulled it out. So you have to be able to know the different sounds. So I've gotten so in tune with the machine that I know when one plug come out, I know where it's connected to. So with trach babies, because they do have the collar, sometimes the trach will pop out and it's sitting like this to the side, and you don't know until your baby's blue. So you have to make sure that, and that happened to me. I don't know what, God's good, because he woke me up and she had pulled it out, but you have to, because you can't hear it. When you have a baby that has a disease, you don't hear their breaths, like you hear ours. So hers were silent. So I woke up and my baby was blue. Her trach was out. I didn't know. So, you know, that being in that moment, you have to be able to put everything aside and just react. Don't panic. I would say don't panic. Do what you're trained to do. And don't, when they say you need two people, when you thinking your baby is about to die, you're not going to be running around saying, hey husband, hey wife, hey
Yeah.
you're going to be like, let me put this back in and we'll deal with everything else
Like, yeah.
later. So my advice is to be strong, be involved. I was very, very involved. Everything that Callie had going on, I wanted to know. I was looking like, okay, what are you doing? Can I do it?
Yeah.
Because if you don't help, when you come home, you're going to be lost. You're going to be lost because it is overwhelming with the amount of supplies, the amount of equipment, the amount of not having any sleep. And essentially as mothers, you pretty much do it on your own. I know for me, you're doing it on your own because my husband's just scared.
Yeah.
It's like, I don't want to. So as the mom, you have to, for me, you have to step up. So I would say rest. Take time. If your baby's in the hospital and you're thinking about having a trach baby or any baby that's in the NICU, take that time and let those expensive, I would say $1 million nurses or babysitters that you have in the hospital.
Oh my
take
goodness.
that time to rest, because once your trach baby come home, you have to, and I say this with, you have to be on alert at all times, because if that trach comes out and you're asleep, that 5 minutes, you can wake up to a dead baby. That's how serious and that's how alert you have to be when that machine goes off. And I know people may not tell you, or the nurses may not tell you, but when the trach pops out, it takes a long time for the machine to register that the trach has actually came out. So it may take 30 minutes before that alarm goes off, because it goes off the pressure. And if the trach is near the Velcro it's thinking it's breathing into the baby. So it's not registering that it's not in the inside. So that's why you have to make sure, I would say that would be my biggest advice, is to make sure when you wake up in the middle of the night, just check to make sure that the trach is in, because the machine may not register that the trach is out. And I say this because I have a friend that happened to, and their baby almost died. The trach was actually out for about 2 hours. And so, and the baby ended up having a stroke because she was trying to breathe and trying to keep up with it, and having a stroke. So I would say, but no one told us, no one told us that things like that could happen. So that would be my advice, to make sure you're always checking that trach, making sure that you can at least get one finger in, because you want to make sure it's tight enough, because it can slip out. Try to keep, if you can, the little mittens on your baby, so your baby won't try to grab at it. But as they get older, of course, they do come out. They will pull it out. They will pull it out, and you just have to not be scared to put it back in, or ask for help if you're out and it happens to come out, and you need help. If it drops on the ground, don't put it back in. Don't put it back in, because you can cause a lot of damage. That's why you always have to have an extra trach. I would say having your bag is very, very important. Your emergency bag that have your ambu bag in it, have your extra trach, your extra ties, your lubrication, your saline, a roll. So if you have to do it by yourself, you can have some support. So it's very, very, very important to have that emergency bag with you, just in case that trach does come out, and you need to be able to use it. However, if you don't have a trach, you have water. rinse it off really, really quick. I would say that rinse it off really, really fast, and make sure you always have the operator and put it to be able to put it back in. So emergency bag, emergency bag, emergency bag, emergency bag. Make sure you always never, I say never leave home without your emergency bag, especially for your trach babies, because that can mean life or death.
Oh my gosh. And you guys, so Lakithia is one of our mighty little giant mommies. And so we will definitely, if there's anyone who has a baby who needs a trach, who has a trach, is being talked about, is being brought up in the hospital, we can definitely connect you to Lakithia, and she could be your sister throughout your trach journey. So I just want to thank you so much, sis, for this conversation. My goodness. It's just so much. And
it's a lot.
Every time I talk to you, I'm like, oh my gosh, what would I like? I thought I was going crazy with the oxygen. And then, yeah, we did have medication every 4 hours, but to add on the trach and to add on how you have to like know that intuition, right? Of just like, some don't feel right. Let me go check. Of like, like sleeping, the trach comes out, Callie's getting bigger, but you've been holding it down, and we are so grateful for you. And we thank you. I'm gonna stop our live. Thank you guys so much, but you stay on, sis. Thank you guys. We love you. Make sure to go. So as we close, next week we're going to be talking to Nurse Ebony on just the NICU in general. So make sure you tune in next Wednesday at noon. But we love Miss Lakithia, and we'll put her information in the chat if you guys have any questions. Bye. Oh, one last thing too. If there's anybody talking other than Mama and Sarah, but I'll send you guys stuff too. I was going to put everybody's name in the Wheel of Fortune and send you a special prize for joining in from Mighty Little Giants for NICU Awareness Month. Thank you guys.